Hey everybody, it's Barbara and it's time for another Motivational Monday, and today I'm going to be talking to you about potassium, a very important mineral. What a lot of people don't realize is that potassium and sodium kind of go together, but what you want to achieve is 4 potassium for every 1 sodium. However, because so many of us are eating fast food or packaged food, canned food or bagged food, or eating in restaurants and certainly not cooking at home as much as we'd like, our levels are becoming skewed. So instead of 4 potassium to 1 sodium, it really kind of looks like 1 potassium for 4 sodium. Well, that's not good news for our body, because potassium is an important mineral that helps protect you against high blood pressure, it helps with nerve transmission, it helps protect your cardiac function, and helps in the prevention of strokes. So again, you see, that's super important. Symptoms that you might have low potassium levels include muscle cramping. So if you get those cramps in your legs in the middle of the night, or if you find that your legs get cramped up throughout the day, you might be deficient in potassium. An irregular heartbeat, constipation, and fatigue and weakness in your muscles are also a sign of low potassium levels. So who needs to supplement? Well, if you have any of those symptoms, you want to talk to your doctor and see if you need to supplement potassium or if you need to make a more concerted effort of getting potassium through your food. Additionally, if you take a diuretic that does not spare potassium, so let's say your doctor has recommended that you take a diuretic to manage your blood pressure, and it does not spare potassium, meaning it does not leave potassium in your body, and instead you're urinating out your potassium, then you definitely need to look at your potassium levels and talk to your doctor about the best way to supplement it. But you will see that it's easy enough done through food. How much do we need? Well, the Linus Pauling Institute suggests that we take in 4,700 milligrams of potassium a day. Now that seems like a really high number, and it is high considering some other guidelines suggest anywhere between 2,000 and 3,000 milligrams. But again, because year after year we're eating way more sodium than our body needs at any given point in time, our needs for potassium increase as well. So I'm going to go with the Linus Pauling standard because I think more in this case might be better, just to counteract some of the sodium that you might be getting in your diet. So you'll see when we go through these foods how easy it is to do that through the way that you're eating. So here's a cup of spinach. 1 cup of spinach gives you 840 milligrams of potassium. That's great. 1 cup of carrots gives you about 350. Half an avocado, 450. 2 ounces of almonds, about 400. Tomatoes are a great source of potassium. I have here a little bit of my sun-dried tomato pesto. This is about 100 to 150 milligrams of potassium. A baked potato will give you about 1,000 milligrams of potassium, and even if you just eat half because you're trying to manage your carb intake, that's still 500 milligrams of potassium. 1 banana gives you about 470 milligrams, and coconut water. Coconut water has become a great new beverage. A lot of people, you might see a lot of people drinking it. It's a great recovery drink after you've worked out. It helps to replenish electrolytes that might have been lost through sweat. So 1 bottle of this will help you feel great after your workouts and also deliver about 600 milligrams of potassium. So let's say you're setting about trying to achieve your 4,700 milligrams a day. You'll see it's easy enough done. 2 cups of spinach. You're going to make a salad with that, and it's easy enough to eat 2 cups of spinach. Put that in a bowl. There's 1,680 milligrams of potassium, just about 1,700. Add to that a cup of chopped carrots. There's another 350. Half an avocado, another 450. And if you want to add some chopped nuts to that, there's another 400. There's lunch. Then you go to work out later, and after your workout, you decide that you really would like a great coconut water to rehydrate, and a banana because you just had a really good workout and you want to replenish. So that right there gives you a nice amount of potassium. Then you get home later that day and you have your dinner and you decide to have half a baked potato because you're trying to mind your carbohydrate intake, and that's 500 milligrams, but you're going to add a little bit of that tomato pesto to it because it tastes so good, or you might have it with a couple of crackers before you have your meal. If you eat these foods in one day, you're going to take in about 4,650 milligrams of potassium. That's a great amount right there, and it's easy enough done, right? And you can still incorporate throughout the day in other ways. So who should not be looking to supplement their potassium? Anybody that has kidney disease. If you've been diagnosed with kidney disease, if you're a type 2 or type 1 diabetic that's poorly controlled and your kidney function is starting to become impaired, then you definitely want to be mindful of your potassium intake. You do not want to exceed more than 500 once your kidneys become compromised. So talk to your doctor about that and see what's right for you. So if you like tips like this and you're looking for more information on how to optimize your nutrition and your well-being, then check out my blog at rootsandseeds.com. There's loads of cooking videos on there, just informational videos, how to get calcium into your diet, different other suggestions to help you live a healthy and happy life. And if you want to know more about me and my practice, then check out BarbaraMendezNutrition.com. Please leave me your questions or your comments below. I'd love to get your feedback. And if you'd like, you can follow me on Facebook or Twitter. Thanks so much and have a great day.